Hi, Dr. Brian Koffman, a retired family doctor and the Chief Medical Officer at the CLL Society, and I'm presenting my top 10 papers from ASCO, the American Society of Clinical Oncology's annual meeting in Chicago, Illinois in 2019. And we're now presenting paper number 2. The effects of fixed duration Venetoclax plus obinutuzumab, Ven-G, on progression-free survival, PFS, and rate and duration of minimal residual disease negativity, MRD negative, in previously untreated patients with chronic lymphocytic leukemia and comorbidities. This important large phase 3 trial was the CLL 14 study led by Professor Michael Halleck in his large German study group with support from many other centers. The trial compared patients who took standard doses of chlorambucil plus obinutuzumab, a third-generation, very potent monoclonal antibody used to control CLL, or Venetoclax with that same obinutuzumab. 432 patients were enrolled, with 216 in each group. After 29 months, they started to take a look at the data, and there was superior progression-free survival with the Venetoclax group versus the chlorambucil group. There was superior MRD negativity with the Venetoclax group in the peripheral blood, 76% versus 35%, and in the bone marrow, 57% versus 17%, 3 months after the treatment was completed. Over 75%, or overall 75% of the Venetoclax MRD negative patients who were negative in the peripheral blood were also negative in the bone marrow, where only 49% of the chlorambucil patients who were negative in the peripheral blood were also negative in the bone marrow. The bone marrow is harder to clear, and where the disease may relapse, that's where the cancer grows, so clearing the bone marrow is important, and the fact that you can get negative in both with the Venetoclax obinutuzumab arm seems to be a superior finding. They also found that MRD negative status, as you'd expect, was associated with better progression-free survival. Higher MRD negative rates were achieved earlier and were more sustainable with the Venetoclax group. 81% of the Venetoclax group versus only 27% of the chlorambucil group were MRD negative 12 months after treatment. So in conclusion, what we're looking at here is that this Venetoclax obinutuzumab combination offered deep responses. Sometimes they even did next generation sequencing and got down to 10 to the minus 6 negativity in 1/3 of patients, leading to high and long-lasting MRD negative, or as it's more commonly called now, MRD undetectable rates, with a very low rate of conversion to MRD positivity 1 year after treatment in previously untreated CLL patients with comorbidity, translating into improved progression-free survival. This certainly urges us to take a look at this potent combination of Venetoclax and obinutuzumab as a frontline therapy for CLL patients. Thanks very much for listening.